and welcome back to my channel. In this video, I'm actually going to break down my top most heard breastfeeding myths. I know breastfeeding is something that is becoming a lot more common, and I'm so delighted that it is, but there's still an awful lot of myths floating around out there. And actually, when I opened up this question on my Instagram page, which if you're not following me already, please make sure that you are, and click that join button down below. I have it linked to the bottom of the cards of this video. If you aren't following me already, I put up a question box up there last week and got a huge amount of responses with all sorts of new myths that I had even never heard of, despite working in the breastfeeding world. So I'm here to bust some of those myths and to give you some more knowledge around the facts when it comes to breastfeeding. So myth number one is that many women simply do not produce enough breast milk for their baby. And that is quite possibly one of the biggest things that I see with my clients, which is what we know as perceived low milk supply in the breastfeeding world. Often perceived low milk supply can be quite a scary place to be, but the good news is that less than 5% of women cannot clinically make enough milk for their baby. Even when that is the case, oftentimes there are ways around that. So make sure and speak to your lactation consultant if that's something that you're concerned about. So the second myth, and quite possibly the second most commonly occurring breastfeeding worry that I see, is that breastfeeding is going to hurt. And it doesn't have to. Breastfeeding should not actually hurt at all. While it's quite common for there to be some degree of discomfort in the early days as you are learning to latch your baby on deeply at the breast, and as your body is getting used to that sort of increased level of stimulation as your baby suckles on the breast and on the nipple, it's not normal for it to hurt. In fact, if you are experiencing pain, so anything more than sort of a toe curling sensation that eases as your milk begins to flow, indicates that there's actually an issue there regarding your baby's latch or regarding their ability to transfer the milk from the breast, so perhaps some oral tethering like a tongue tie going on. If you are experiencing pain at the breast, make sure that you contact your lactation consultant today. This next breastfeeding myth is about your baby not having any milk until day 3 or 4 of life. And I really hate that phrase of your milk coming in, because I think this is what it kind of implies. In fact, that colostrum that is present from about 16 weeks in your pregnancy is exactly what your baby needs. The small volumes and quantities that colostrum is available in those early days are exactly for that reason. Colostrum is really high in antibodies, in fats, and all sorts of other immune boosting ingredients. And the reason that it's available in such small quantities is because your baby will feed little and often in those early days. And remembering that your baby as a newborn, their tummy is only the size of a marble. So anything more than that, and they simply wouldn't be able to take it in. What I prefer instead is to think of your milk as transitioning from that sort of liquid gold colostrum of sort of a runny honey-like consistency to the later sort of more liquid and milky consistency about somewhere between day 3 to day 5 after your baby is born. Next, and quite possibly the most irritating of all of the myths that I've heard so far, is that your baby should feed for X amount of time on one breast before being offered the other breast for X amount of time. So what I hear most commonly is 10 minutes each side. And while I do, as a lactation consultant, recommend offering both breasts per feed, I prefer the analogy of allowing your baby to feed from the first breast first. So what your baby is doing in that instance is they're accessing all of those sort of fatty globules and little sort of sticky globules that are stuck to the inside cells of your breast tissue. And those fatty globules are what makes your baby feel satiated, feel full, but also helps them to gain weight. So while it's really important to make sure that your baby is sort of stimulating the breast really well, I always prefer to think of the first breast first analogy, so sort of like a dinner and dessert. So if you're imagining you're out for dinner with your partner and you know dessert is on the menu, you might not necessarily always have it, but it's always on offer. So allow your baby to feed from the first breast first. When they show signs that they've had enough there, so they either pull away or they fall asleep at the breast, you might want to offer them the second breast and see do they want any more milk. The next myth then, and I hear this a lot kind of during the summertime, is that breastfed babies will need extra water additional to being fed at the breast. So this simply is not true. In fact, during the summertime is when our bodies really show just the magic of our breast milk making abilities. What your body does is it caters to your baby's needs specifically. So whether that is your baby's age, whether that is the time of day in terms of the hormonal component of our milk, so we'll make sort of more sleep-inducing milk in the evening times as opposed to during the daytime, or whether it's your baby who's sick and teething and your body creates antibodies specific to their requirements. Same goes for during the summertime when your baby requires more a higher fluid content, a higher liquid sort of rehydrating content and water content in the milk as opposed to those fatty components. So if you were to do a little bit of pumping during the summertime versus during the wintertime, you would physically see a distinction between those two types of milk for your baby's needs. One of the next myths or sort of questions that I get during my antenatal breastfeeding preparation sessions is, do I need to wash my nipples or my breast before every time my baby feeds? And this is a huge misnomer. In fact, I think that where this one comes from is from the formula industry, which of course formula is not a sterile preparation, hence why we have to boil and allow the water to cool and sterilize all of the equipment when we're giving our baby formula. Whereas if your baby's feeding at the breast, your breast milk already has components that are antiviral and anti-infective properties. So that's actually quite the opposite. In fact, if you were to be washing your breasts any more than sort of twice per day with just warm soapy water to avoid sort of particularly if you have kind of cracked open nipples, that can be a great way of avoiding infection entering the breast. But if you don't have those, in fact, all you're really doing is stripping away some of those natural lubricating oils released by the Montgomery glands on the breast to help protect that area. Here is another one. So this particular myth is regarding the volume of milk that you are pumping being a clear indicator as to how much milk you have for your baby who feeds at the breast. And this is a huge one, and your body is actually a lot more clever than we realize, and a pump is never ever going to be able to do as good a job as your baby at the breast will do. So there are some things that you can do to sort of optimize your output, particularly if you are an exclusively pumping mum. So things like a warm compress, using your hands, sort of a hands-on technique, doing a little bit of massage before your baby goes to the breast, a little bit of lubrication, and of course correctly fitted flanges for your breast pump, making sure you are using a hospital grade electric double pump means that you're going to be able to maximize the output that you can get, but of course it's never going to quite be the same thing as your baby going to the breast. So another breastfeeding myth is that breast milk simply doesn't contain enough iron to meet your baby's needs. In fact, if your baby is born at full term, breast milk contains just the perfect amount of human heme iron for your baby to digest. In fact, formula contains too much iron, and the reason for that is that our babies find it a little bit harder for your baby to digest, and so as a result a lot of it is excreted as your baby finds it hard to break down. So what if your baby's born at full term, by 6 months of age you might want to be starting to think about more additional, so sort of high iron content solid foods is a great starting point if you're just beginning that weaning process. But other than that, your breast milk is the perfect addition for your iron rich diet. This is my personal favorite. It's easier to bottle feed your baby than it is to breastfeed, and those mums who breastfeed get less sleep than those who formula feed. And this is my favorite myth to bust, because research tells us that in fact breastfeeding mothers get at least an hour more sleep at night than those who are formula feeding. There is a little bit of an argument here because of course the roles can't be shared in the same way. You can't hand your baby over to your partner for the night for them to take over bottle duty. However, there's a lot to be said once breastfeeding is really well established and you and your baby are happy in terms of your latch and feeding and positioning. It means you don't have to get up out of your bed, go down to the kitchen, boil the kettle, cool the water and make up your formula bottle. You also have less washing to do in terms of sterilising and things like that. So there's a lot to be said for just having your baby right beside you and having them snuggled into you and having the milk available at the right temperature, at the right quantity, at the right time, readily available for whenever your baby is hungry. The next breastfeeding myth, which is actually quite an interesting one, and again depends on what take you have on it, is that breastfeeding ties the mother down. I would really argue this because I do think that while yes, you are the only person that can feed your baby, unless of course you introduce, cup feeding or a little bit of bottle feeding here and there, if you're exclusively feeding at the breast, there are also lots of benefits to that. So it means quite often that you have your baby there with you, so you don't ever have to worry how they're doing. It also means that you don't have to worry about where's the next place that you can warm up a bottle. When is there going to be a sterilizer available for you to make up a bottle for your baby safely, that you are not going to be wasting money on formula and sort of all of the components in terms of making up your bottle safely for your baby. It also means that you have freedom in terms of knowing that your baby's health is going to be that bit more optimized versus a baby who doesn't get the benefits of breast milk. One of the biggest myths that I hear is that you simply cannot quantify how much milk your baby is getting at the breast. I love that meme that's floating around at the moment, which is a doctor being asking a client or a patient of theirs how much milk their baby takes, and the mum says, a boobful. The answer is exactly in that. So knowing that your baby is attached well at the breast, they are sucking and swallowing for the majority of their time at the breast, so for about 80% of a feed, that you can see and hear those swallows. Every sort of 2 to 4 sucks to 1 swallow is a good ratio to kind of be looking for. Looking at their dirty nappy output, so looking that they're getting about 6 wet nappies a day, so that works out at about 150 mils being poured into a dry nappy to get an idea of quantity, and that they're getting plenty of dirty nappies. So that's where it's really at. It's very, very easy to quantify how much your baby is getting by looking at those other things, but also by looking at the more holistic picture. Is your baby alert during feeds? Do they have a nice colour? Do they have a nice tone? Are they meeting those developmental milestones and following along in that nice curve in terms of their weight? Things like that can be a great indicator when it comes to knowing what to look for in knowing your baby is getting enough milk at the breast. So now we're getting towards the end of these breastfeeding myths, but one of the other ones that I hear an awful lot is, isn't formula just the same at this point in time? Hasn't science come on so far that we are now able to almost exactly replicate the properties of breast milk? Unfortunately, we're quite a long way away from that. So if you think that breast milk contains about over 200 different breast milk components, formula contains about 90 on average. So there's a big difference there. As well as that, formula simply cannot contain some of the live substances that are available in breast milk. So for example, enzymes, pre and probiotics, anti-cancerogenic properties simply cannot be replicated in our man-made formula. The sort of biodiverse components of breast milk, whereby it's always changing to meet your baby's demands and needs, cannot be made in a way that are available in formula either. The good news is that every little drop of breast milk counts, and some more recent research from China shows that approximately 50 mils per 24 hours makes sure that your baby gets all of those fantastic benefits. So some of the benefits within those sort of parameters showed a significant reduction in necrotizing enterocolitis, which is a fatal or can be fatal particularly to premature babies. It's an infection of the gut lining. So those babies who had a minimum of 50 mils per day of breast milk had significantly less impact of that disease on them, as well as less infective diseases such as lung infections and chest infections. These babies also went on to have less likelihood of developing childhood cancers like leukemia and ear infections as they grew older in life. So just goes to show the term liquid gold is so much ringing true here. Every tiny drop counts. One of the biggest myths that I hear kind of from an ongoing basis from a hospital perspective is that if I'm unwell or if my baby is unwell, that I should stop feeding for that duration of time. And in fact, I would nearly go as far as to say that's the worst thing that you can do. When either you or your baby are unwell, the best thing that you can do for you and your baby's health is to feed, feed, feed. The reason for that is the biofeedback loop that comes as a direct result of breastfeeding your baby. So as your baby feeds directly at the breast, through their saliva, they're actually sending messages to you to tell you what's going on with them at that moment in time. So for instance, if they've been exposed to some sort of bug out and about, or they're dealing with a tummy bug, what your body does is it creates antibodies specific to their requirements and delivers them through the breast milk to protect them from whatever it is that they are struggling with or whatever's going on with them. Likewise, if you yourself are unwell, you are already creating antibodies specific to fighting that particular illness or sickness. They are going to be delivered as a protective property for your baby when they continue to feed at the breast. The last one then, and sort of linked in with the myth prior to this, is that if I have to take any specific medications that I should stop breastfeeding my baby. And the reality is a very, very small amount, approximately only 1% of every medication you take actually is carried through to your breast milk. It's always worthwhile looking at the alternatives, so making sure that you say to your care provider if indeed it is essential that you are started on medication. And the majority of medications are actually available in so many different forms nowadays that there will always be an alternative that is breastfeeding friendly. So asking a really well-versed pharmacist, or indeed asking your healthcare provider themselves about what the different options are really, really important. You minding yourself is key, because you cannot mind your baby unless you're looking after yourself first.